This is a quite serious thing that can lead to fatal outcomes. It is practically impossible to get rid of the so-called apron, which is excess skin. And so, yes, they are extremely concerned. They always inquire, can you make a small cut, a smaller one? Abdominoplasty is considered a rather complex operation. It is a flap operation. This operation should be performed by a qualified surgeon because nowadays many people in principle perform this operation. Now plastic surgeons are doing it, and plastic surgeons are becoming it. Craniofacial surgeons who generally perform more facial surgeries. Furthermore, general surgeons who are the nearest in proximity to this operation, because it is still a tale of visceral surgery, of abdominal surgery. In fact, this procedure is rather serious. If it is carried out by a surgeon with limited experience, there might be specific complications. And in order to avoid these complications, watch this video until the end, and to simply achieve the desired outcome that will bring you happiness for a long time, and you will be content.
We get plastic surgery like we get coffee, not realizing it's a serious operation. And if there's a possibility not to do it, it's better not to do it. It's better to manage your weight naturally or address it through exercises. Yet some people are quick to opt for surgery without understanding the consequences.
So, individuals exercise, yes, they lead a moderately healthy lifestyle, monitor their diet, participate in sports actively, yes, but here the situation is slightly different. Yes, they are able to lose weight. Some of the so-called visceral fat behind the abdominal wall is reduced. Yes, they lose a little bit, but actually it's quite difficult, I would say, impossible to get rid of the so-called apron, that is excess skin. If it is already hanging like, a second floor, then it is not going anywhere. There are no such procedures, and unfortunately, probably not in the near future. It is anticipated that these procedures will emerge to get rid of this excess apron. Now, obviously, there is a tremendous amount of propaganda in the mass media, and so on and so forth. Manufacturing companies come up with various devices like liposuctors or equipment for mini abdominoplasty, which supposedly allow this to be done without incisions. Well, to be honest, I haven't seen a single case or any successful work that would allow this to be done.
How much do girls who come for abdominoplasty actually doubt, fear, and so on? How much of it is true out of fear?
Well, I would say, if on a 100% scale, I would say around 80 mostly. Because, well, for example, I had a patient yesterday who came with her husband. They came from India. She has 2 children, so she came specifically to consult on abdominoplasty. And actually looking at this patient, it was evident that the level of her anxiety was quite high. I thoroughly examined the patient. She comes from a wealthy family, is involved in sports, has 2 children, and is in excellent shape because when we consider the anterior abdominal wall, I would divide it into upper and lower sections, as well as lateral compartments, such as flanks and rows. Well, basically, it turns out that from the top, if it's still possible somehow, yes, they're to compensate with sports, diets. Then when a person loses weight, yes, this apron of skin, so to speak, yes, and excess skin, they sag down. And so it's already difficult to get rid of this. And that's why, yes, they are very worried. They always ask if it's possible to make a smaller incision, for example. Such moments are always present with patients. Of course, there is a category of patients whose level of anxiety is minimal. And if you are concerned and in a similar situation, contemplating whether to undergo this operation or not, like this video, and I will inform you about all possible complications of this surgery, how to choose the right surgeon correctly, and why it's better to actually have this operation now to follow the correct path of rehabilitation and later enjoy your results, continue engaging in sports, maintain your figure, and savor life. How does the operation actually occur? The operation, of course, is done under general anesthesia because it is a fairly extensive procedure. The surgical operation entails the requirement to extract additional skin from the front part of the abdominal wall and address the quality of the muscle tissue in order to improve its condition. The so-called ab muscles of the anterior ab wall need to be strengthened if there is a diastasis, which usually exists accordingly, solving the tasks of eliminating this diastasis. Therefore, the prep for such an operation should naturally be approached appropriately. What will it include? It will include a full assessment. You need to undergo tests, check your medical history, meaning whether you have any chronic diseases, autoimmune diseases, such as diabetes or any conditions related to the blood clotting system, whether you are taking any medication, cardiovascular diseases. So it is necessary to gather a complete medical history and prepare for this operation, have a consultation with an anesthesiologist, and check your lungs. Basically, once all these aspects are taken care of, it can be said that you are conditionally prepared for this operation. This is a general so-called preparatory plan. With regards to the abdominoplasty, it is natural that all cases are individual, and it is important to have a specific discussion about the flap plan with your surgeon, as the planning of the abdominoplasty itself is done directly with your surgeon, taking into account your unique circumstances and needs. Because there are various nuances with relocating the belly button, typically you are always troubled by this question of how mine will look, what kind of belly button there will be, and whether it's possible to make the incision shorter. So all these nuances you will be discussing directly with the surgeon, with your surgeon, let's say, as the final consultation right before the surgical procedure takes place. This is a clinic's question. If we are talking about the upper part of the abdomen, then to correct diastasis, yes, in any case, without transferring the spider, this task is practically impossible. At present, yes, they are attempting to create certain endoscopic moments, but to be honest, the efficacy of all these narratives is not particularly high. So, can diastasis be corrected endoscopically, meaning through small incisions or punctures? Yes, certainly, it is indeed possible. However, it is not possible to eliminate or remove the surplus skin. In accordance with this, our ultimate aim is for you to successfully achieve, for example, a more toned and flatter stomach area. The majority of individuals desire a flat, athletic abdomen in order to appear as natural and aesthetically pleasing as they can.
And the last operation you did was like that?
The most recent operation, well, here I carry it out as a result in Dubai, a woman from the local area. She is a mother of 3 children. I did not just perform abdominoplasty, but rather I performed lipoabdominoplasty with fat transfer, as per the requirements, or with buttock lipofilling, as it is commonly called. So it was actually a complete lipoabdominoplasty procedure with buttock lipofilling included.
Where are you inviting me to? To a clinic in Dubai or in Russia?
I work at a hospital in Dubai. It's quite a good hospital. There are many Russians here, as well as many locals, Emirati ladies, so to speak. And let's consider the population of Europe. This is a type of Central Europe. So if you are presently in Dubai or planning to visit Dubai and searching for such an operation, such a consultation, then please click on the link provided below the video to access more information and details. I'll be glad to consult with you, tell you about all the nuances of these operations, what to pay attention to in your specific case, and provide you with detailed recommendations. So come, I'll be glad to consult with you.
In general, what are the factors that cause negative consequences for girls after undergoing this operation?
So the primary reason for the occurrence, I would say, of negative consequences after this operation is the failure to follow the doctor's recommendations. Because it is very important to follow all the doctor's recommendations in the early post-operative period. As an illustration, I once came across a story about a patient who, following abdominoplasty, experienced such a remarkable improvement in their well-being and satisfaction by the 2nd or 3rd day that they made the choice to cease wearing the special supportive belt, or as it is commonly referred to in this setting, a compression garment, which plays a crucial role in providing support to the abdominal wall and facilitating the healing process. However, in this case, the patient did not follow these instructions, resulting in a slight separation of the stitches in the area of the postoperative wound. The patient encountered wound dehiscence, and subsequently, following this dehiscence, the wound became infected, thereby leading to tissue necrosis at the edges of the wound area. To put it differently, along the scar line there was a partial marginal necrosis, as it is referred to in the field of surgical procedures and medical practice. Accordingly, to the best of my knowledge, this additional history concluded in a favorable manner. Nevertheless, after a period of 6 months, this particular patient had to undergo a procedure known as a hand correction operation. There is a concept in surgery where, after a period of 6 months, we perform revision corrections in that area to enhance the aesthetic appearance of the scar. Skillful in order to make it less noticeable, there are certain aspects that need to be corrected in the scar tissue. Another frequently encountered situation is when patients often make requests for the removal of what are commonly referred to as drainage tubes.
Accordingly, following the surgical procedure, we install a specialized drainage system that enables us to eliminate the fluid that has accumulated in the body.
This is blood. This is the so-called lymphoid tissue. That is, this is a normal occurrence after the surgery. And here, in fact, we position these drains to eliminate the accumulated fluid from the body. However, patients usually find it quite challenging to be there. They simply need these drainage systems for 3 to 5 days, sometimes even up to a week. Actually, we try not to keep it for more than a week, but it depends again on the situation. Some people have more fluid, some have less fluid. Patients try to get rid of these tubes as quickly as possible because, simply put, they are uncomfortable. In life, in everyday situations, etc., and sometimes surgeons give in to patients' requests, remove these tubes prematurely, like sort of as if everything is fine. And then, accordingly, there is nowhere for the fluid to go in this case, and it starts to accumulate between the muscle and actually this flap of the anterior abdominal wall. As a result, a complication such as seroma occurs. It is a buildup of fluid. What are the potential dangers linked to seroma? Well, there are also a number of points, a number of peculiarities there. So if these seromas are not evacuated in time, not noticed, this can lead to an inflammatory process, an increase in temperature, deterioration of the overall somatic condition, and overall infection of the entire situation. At times, seromas can be minimal, resulting in tissue scarring. In other terms, in the region where the seroma forms, between the peritoneum and the anterior abdominal wall, a section of fibrous tissue may develop. Accordingly, fibrous tissue will then tighten the flap that we see on the anterior abdominal wall of the skin. This will look like an area of sagging skin, consequently, an unsatisfactory aesthetic appearance. In fact, there are, roughly speaking, so-called golden standards, but as a rule, we try to keep these tubes for an average of 3 to 4 days, and we monitor the amount of fluid we receive within 24 hours. So we measure. If, approximately speaking, the level is minimal there, yes, then today we see this much, tomorrow it becomes even less, and the day after tomorrow it is there. And practically, this serves as an indicator that it's time to remove these tubes because, again, these tubes are also not needed. Keeping it for an extended period of time, oversteeping, because through these tubes, some infection can actually occur. And they will be themselves, that is, let's say, an irritant agent inside, because ultimately it is something that is widely accepted and embraced by the general public. Furthermore, they will also elicit a particular reaction in the body, causing the generation and accumulation of specific fluids, and as a result, the primary concern that arises is the risk of infection. Therefore, here we strictly separate by the amount being removed. If we see that there is a small amount being removed and it is not accumulating, we can remove everything. But if, for instance, as it turns out, we witness the moment when, for instance, it necessitates requests to eliminate on the 2nd or 3rd day, and simultaneously the quantity being separated is rather substantial, I would state then naturally the patient is in a rush. There can potentially be another situation where, for example, a surgeon is inexperienced and possesses knowledge about complications such as seroma, so they make an effort to maintain it by keeping the drainage systems in place for a longer duration of time. So, in order to ensure that nothing accumulates, that this is safe, and so on and so forth, In principle, on one hand, it is not scary because throughout the process the individual is undergoing antibacterial, anti-inflammatory therapy, which will prevent infection and support our, let's say, surgical operation that we have carried out. Well, in fact, obviously, it is improbable to become infected. Nevertheless, something undergoes fermentation there, and certain disagreeable remnants might persist subsequently from an unpleasant moment. Therefore, it is better not to keep the body for too long. Throughout my practice, I have encountered different categories of patients, those who were a bit hasty, rushed, and usually they already know everything about the surgery, they are well informed, they even know all the details about the operation when they come in. They ask minimal questions precisely, and usually in the post-operative period, they almost start commanding the doctor on when it is time to remove the tubes. There is an additional circumstance in which they listen to the doctor. They are extremely obedient and not in a rush to go anywhere. Which patient group do you identify with? Comment about it. The third cause of negative outcomes after this procedure, I would probably unfortunately attribute to a surgeon who lacks sufficient qualifications. Or he is not so much unqualified, he simply lacks extensive experience, for instance, with abdominoplasty or other similar operations of that nature. And in fact, this particular moment is quite commonplace, I would say, and it is definitely worth paying attention to when you are in the process of choosing your surgeon. Where can this lead? Well, at the very least, you will be dissatisfied with how your outcome turns out, how your tummy will look after the surgery is completed, and the overall result is visible. I would most likely consider this to be minimal since your surgery went without any complications or issues. Let's say, because he wasn't completely, let's say, qualified specifically for this operation. Yes, he was cautious in some aspects, but in others, something else. And accordingly, based on it's not bad, but based on this, you didn't achieve the desired result. Another factor to consider is that, conversely, when a surgeon is inadequately qualified in this field, it can result in potential complications and risks during medical procedures. However, simultaneously, he does not experience fear. He endeavors to attain the utmost outcome that has been pledged by you. He, let's say, is actively working with this apron, making an effort to pull it as much as possible in order to achieve a tight tummy, a beautiful tummy that he desires to have for a more confident and attractive appearance. And this is the point where quite serious complications arise, particularly when it comes to the process of repositioning the flap. Violation of trophism. Trophism, in simple terms, refers to the circulation of blood or the provision of nutrition. And here arise complications, which we have already discussed with you. This includes seroma, they also occur, but are much worse. These are already multiple necroses, blood necroses. Sometimes even in the area of the umbilical ring. Necrotic processes occur due to moments associated with tissue trophic disturbances, and these complications are quite unpleasant, necessitating attention and appropriate treatment. Usually second and third surgeries are needed to correct these issues, and often it is not always possible to rectify them. These surgical interventions are crucial for addressing the complications and improving the patient's condition. Therefore, it is important to closely monitor the necrotic processes and promptly intervene to prevent further deterioration. Comprehensive and specialized care is essential in managing these complex cases. It all depends once again on the individuality of each particular story. Another possible consequence of a surgeon's lack of professionalism is necrosis. Unfortunately, such instances occur, I wouldn't say quite rarely, but infrequently. Well, I would say that if a surgeon completely disregards all the rules of surgery, that is the first point to consider, and all the points regarding the lifting of flaps and understanding blood supply should not be overlooked or underestimated. If he doesn't grasp anything and, roughly speaking, executes manipulations, then sadly these instances will occur.
Are there really so many of these surgeons who don't understand a damn thing?
Here is a slightly different perspective. Occasionally, as surgeons, we strive for the idea of achieving exceptional results and have a desire to go the extra mile for the patient. And when we exceed this threshold by a small margin, there, accordingly, the potential risk of this situation increases to a greater extent. We will most likely be discussing moments like lipoabdominoplasty, which is the procedure where we perform liposuction and abdominoplasty together for optimal results. Yes, and here let's say, yes, and here let's say, two surgical camps are forming. The first group says that it is strictly forbidden to do, while the second group says that it's complete nonsense. And why are we doing this? To achieve exceptional results, a highly athletic abdomen, and maybe enhance something else in another area. And in such instances, the likelihood of encountering specific complications increases accordingly, thus leading to an escalation in this percentage of risk and consequently contributing to a higher level of risk, I would say. Consequently, when patients arrive, since patients are already knowledgeable, they typically know the purpose of the consultation. They have already perused all the information on the internet. There is an abundance of information available online nowadays. And generally, they may have already had consultations with 3 surgeons prior to seeing you, so they are familiar with the topics being discussed. And when I, for instance, consult with my patient, I am frank, which means I do not conceal any details. I openly inform them about different types of risks. If the patient, for instance, provides their voluntary consent, like in this scenario, just a small amount, let's say a little bit, I say, well, then here a little bit, but our risks will increase. And she signs, roughly speaking, a specific consent for surgical treatment with a detailed description of these small details, as we call it here, the concept of form. And the third complication, quite a serious complication that can occur, and usually it's specifically due to the surgeon's fault, yes, is when we penetrate into the abdominal cavity. To put it in different terms, when we lift up this flap, we lose one layer, thereby compromising and ultimately undermining the complete integrity of the abdominal cavity as a whole. Actually, it's not scary if this situation has been noticed. If this situation has been noticed, then the muscles are simply stitched up and there are no problems with that. However, if such a situation is not attended to and left unattended, there may be potential risks of developing peritonitis. This is the point when fluid starts to accumulate in the abdominal cavity, and this is where things can ultimately and unfortunately end quite tragically. This will typically always be a reoperation. This is already a surgery that is completely different in nature. This will no longer fall under the category of aesthetic surgery. It is already a specific serious surgical complication when fluid appears in the abdominal cavity. Such a complication is referred to as peritonitis in professional jargon. There are also various types of peritonitis and so forth. This is a serious issue that can result in fatal outcomes. However, the most crucial thing is that all of this can be avoided with proper measures. We carefully choose the right surgeon, avoid unnecessary and excessive superoperations. Do not combine 2-in-1, 3-in-1, although sometimes it happens unexpectedly. And then you will be safe. And of course, listen to your surgeon. Do not violate the rules of the post-operative period. Follow all the doctor's recommendations.